I've had a lot of people ask me what changes should they expect for 2023 with the G plan. And in this video, I'm going to explain what's happening. Now, with the recent legislation that passed Congress, there certainly have been some changes to Medicare that are going to start in 2023. But the majority of those changes have to do with drug plans. And just a quick highlight on that, in 2023, if you're on insulin that's covered by Medicare, the maximum copay will be $35 a month, which is a wonderful savings for people that are on insulin. The second change will be that beginning in 2023, adult vaccinations are going to be covered by Medicare at zero copay. Right now, the only thing that's covered at zero copay would be pneumonia shots, flu shots, hepatitis B, COVID, and COVID boosters. But in 2023, they're going to cover adult vaccinations, including shingles. So now someone can get a shingle shot at a zero copay beginning in 2023. Now, 2024, the neat change is happening then is that the catastrophic stage, which is the fourth stage on all drug plans, if someone gets to catastrophic right now, they pay a 5% coinsurance for their medications. In 2024, that coinsurance goes to zero, so there'll be zero out of pocket once they've reached catastrophic stage. And then in 2025, probably the biggest change that's come to Medicare is that the max out of pocket for prescription cost for anyone receiving Medicare benefits will be $2,000 for the full year. Right now, it's much higher than that. Someone could easily spend $10,000, $12,000 a year. But beginning in 2025, max out of pocket on drug plans will be $2,000. All right, so that being said, those are the main changes that happen for drug plans. Now, when it comes to the G plan, happily, there have been no changes. G plans are still going to be available. I think they'll still be the #1 plan in 2023. But what I'd like to address, though, is really some of the details of the G plan. So we know there's not going to be a lot of changes, but let's talk about why people get a G plan and what's the coverage for the G plan, because I think that needs to be very clear. That part of it is not going to change. So here's the way the G plan works. When we buy any kind of a supplemental plan, basically what we're doing is we're getting a supplemental plan to fill in the gaps. Medicare pays first, but Medicare doesn't pay 100% for anything other than preventive services. There's always a balance. So if I get any healthcare service beyond preventive service, I'm going to have some financial liability, some financial responsibility. We call that a gap in your coverage. And so we have 3 gaps on the A and we have 3 gaps on the B of Medicare. Now, the A of Medicare, remember, is everything that would be inpatient type services. B is going to be everything that is outpatient type services, plus all doctor-related services. Whether I see the doctor inpatient or outpatient, the B of Medicare is going to cover that. And so we have 3 gaps on the A and we have 3 gaps on the B. So the first gap that we deal with Medicare on the A side, this means we're put in the hospital. We have an A deductible. The A deductible this year is $1,556. Now, this deductible is not an annual deductible. It can occur more than once in a year. The A deductible is tied to a hospital stay. And the way it works is if I'm admitted to the hospital, and let's say I'm discharged after 7 days, so I go home, and from the day of discharge for the next 60 days, I am still in my what's called a benefit period. So I'm still covered by the same deductible. So if I'm discharged and during the 60-day window, I have to go back to the hospital, I'm still covered by the same deductible. But if I'm discharged and 60 days goes by and I'm not re-hospitalized, but I'm hospitalized after that, then I'm going to have to pay another deductible. So we could pay this deductible multiple times in a year if we're re-hospitalized. All right, so that's the deductible for the first 60 days in the hospital. That's all we have to pay is that $1,556. Then secondly, that brings us to another out-of-pocket expense, which these are for what we call extended hospital stays. So extended hospital stays are going to create my second gap. And so what this means, if I'm in the hospital more than 60 days, what happens on the 3rd month, days 61 to 90, I am now responsible for a daily copay. That's $389 a day. If I'm still in the hospital longer than that, I'm really, really sick, and it's going to get more expensive. So days 91 to 150, I have to pay $788. You can see what they do. They double the copay. So these are extended hospital stays, which are my second gap. And then the third gap is going to be for a skilled nursing facility. Now, skilled nursing facility is nothing more than inpatient rehab. So this is somebody that has had a stroke, maybe they have had a hip replacement, maybe an injury, an accident or something, but they're going in for inpatient rehab. And so the way this works, Medicare says the first 20 days does not cost you anything as long as you had been in the hospital 3 days prior to going to skilled nursing facility. That's why they always keep you 3 days or longer, because Medicare won't pay if you're discharged earlier than that. So we're in the hospital at least 3 days. We go to skilled nursing, everything covered the first 20 days. But if I'm still in need of care after 20 days, then for the next 80 days, Medicare covers me, but now I'm responsible for a daily copay of $194.50 every day. Okay, so that is my third and final gap on the A of Medicare. Okay, these gaps, these are my responsibilities. So we have this $1,556, we have these daily copays here, and daily copays here for skilled nursing. That's on you.
Hey, if you're looking for someone to help you hold your hand through this entire Medicare enrollment process, we would love to do that. Our team is standing by to help you. We help about 1,000 people a month go from Medicare confusion to having their plans enrolled, and it takes probably less than an hour. Go to the pinned comment below and you can book your appointment.
Now let's talk about the B of Medicare. Again, this is everything outpatient type services and everything that will be doctor related. So on the B of Medicare, we also have a deductible. Now this year, the B deductible is $233. Now this deductible is not like the A deductible. It cannot and will not happen more than once in a year. It's tied to a calendar year. And then this deductible will reset every January, but we only pay it once a year. And after I've met that small deductible, that takes us to the second gap on the B side, which is called 20% coinsurance. Coinsurance, okay? So once we have received any service on the B of Medicare, we've paid our deductible, and then whatever Medicare is going to cover, they pay 80%, and then you're going to pay 20% of the bill. That 20% would be your second gap, your deductible, then we got coinsurance, and then we have the possibility of seeing a physician that adds to the Medicare bill. This is actually called an excess charge. Excess charge. And so this is a physician that adds 15% to the Medicare approved amount. And that's our third gap on the B. Now, just so you know, they tell us right now that about 1 out of 10 doctors will actually add to the bill. But whenever they do add to the bill, you're responsible to pay for it. Medicare allows it, but Medicare doesn't pay any of it. So as you can see by my graph, these are the 6 gaps that exist in original Medicare. So right now, most people are either buying an F plan, a G plan, or an N plan. So let's just differentiate these. Number one, the F plan fills in all the gaps. So that means all 6 of these gaps will be covered by the F plan. It's truly a full coverage plan. Now, the issue is with the F plan that anyone born after January 1st, 1955, starting Medicare after January 1, 2020, cannot get an F plan. Anyone born before January 1st, 55 can still buy F plans and keep them their whole life. Okay, they're grandfathered in. But a few years back, about 5 years ago, Medicare began to phase out the F plans as far as eligibility is concerned. So again, anyone born after 1955 cannot have an F plan, but those who do can get it, and it would truly fill in all the gaps. Now, personally, if I could buy one because I'm born before that date, I still wouldn't, because in my opinion, it's just really not a very good value today, but it still would be available. All right. And so that takes us into the next plan called the G plan. And the G plan is just like the F plan. And in fact, it fills in all the gaps but one. So if someone has a G plan, they would be out of pocket the B deductible. And again, it's just once a year, but the F paid the B deductible, but the G does not. So once a year, whatever the B deductible is, you would be billed for that. And then after that, you have 100% coverage. All right. And then that takes us to the N plan. Again, it's a different letter. It's going to be a lower premium, but now we're going to take on a little bit more financial responsibility. So the N plan covers all the gaps in the A side, just like the F and the G do. But here's where it's going to be different. On the B side of Medicare, if someone has an N plan, they would be responsible for the B deductible, just like the G plan. The N plan would cover all the 20% coinsurance, but the N plan will not cover the 15% excess charge. So that's the difference between the G and the N. On the G, it pays excess, the N does not. In addition to that, what happens is every time that you see a doctor, you're subject to up to a $20 copay to see any kind of a doctor or a specialist, and you'd have a $50 copay if you ever went to the emergency room. All right. And so those are very reasonable copays, but again, you're going to have that financial responsibility. Lower premium, but again, you have to be comfortable with being responsible for excess charges as well as copays anytime you would see a doctor. Okay, so the point is that's what these plans are going to cover. So when we talk about the G plan, what's it doing? It's covering everything that exist within the Medicare gaps other than the B deductible. And that's why I believe it's still really the best plan. And because you have very little exposure, there's not going to be any big surprises. You're not going to be charged excess if you went to a Mayo Clinic or a Cleveland Clinic or one of these places that actually charges excess, and now you don't have to pay that out of pocket. All right, so that's why I still believe it really is the best plan. So we know there's not going to be any changes. We know this is what's going to cover. So let's talk about what it's going to cost. Hey, just real quickly, if you're finding this video to be helpful, you can like, comment, and subscribe. And if you do so, that'll let YouTube know that this is helpful information, and they'll send it out to others who also need to learn about Medicare. Now, keep in mind this particular video will be shown all over the country, so it really depends upon where you're going to live. But the G plan will be based upon, of course, your age in most states. It'll also be based upon your gender. We have usually male and female rates. And then it's also sometimes going to be actually based upon your tobacco status. Some states, if you're a tobacco user, you'll pay a little bit of a higher premium. All right. And then it's going to be based upon your zip code of your county, but typically zip code. So these are the factors that are going to determine what our Plan G premiums are going to be. Now, again, this is going all over the country, so I'm just going to kind of broad stroke this so you get some kind of a feel. Right now, app plans around the country are going anywhere from about $175 to maybe $225, and these are, of course, on a monthly basis. G plans right now are going to be anywhere from about $110 to probably maybe $150 on a monthly basis, and then your N plans are going to be anywhere from usually about $90 or so up to about $120 monthly. And this is going to vary, of course, throughout the country, but this gives you kind of a general feel. And so if I do decide to get that G plan, I've transferred all the liability to the insurance company other than the B deductible, and that's why I'm paying them this premium. No surprises at all. You'll know exactly what you're going to be out of pocket because you only have to pay your premium as well as your B deductible. Okay. Now, one of the nice things about these particular plans, all of these plans, whether it's an F or G or an N or any plan that you get supplemental, is this: there's no networks. Remember, when people get an Advantage plan, they have to live with HMOs and PPOs and network limitations and network restrictions. But when we have a supplemental plan, there's no networks at all. The only thing you have to do is make sure that you're going to a doctor that takes Medicare. If they take Medicare, they absolutely will take your supplemental plan of choice, the letter you choose and the company that you choose. Another thing that's awesome that I believe that has as a great feature with supplemental plans is there's no pre-authorizations. A pre-authorization means that there's a healthcare service that typically is expensive, and if you have a pre-authorization that's required, that means the insurance company has to agree with the doctor and has to approve of that pre-authorization service before you get it. And this would be CAT scans and MRIs and PET scans, any kind of a surgery, a skilled nursing stay. So there's outpatient surgeries and different procedures that the insurance company has to give the final approval. And when it comes to Medicare supplemental plans, you'll notice there's no pre-authorizations at all. If Medicare says they're going to cover it and doctor says you need it, end of story, insurance company has no say-so. This is not the way it will work if you get an Advantage plan. 72% of the services on Advantage plans have to be pre-approved. You will not get an MRI or a CAT scan or a surgery, inpatient or outpatient, anything that's going to be expensive will not be approved by that Advantage plan unless they agree with what the doctor says why this is necessary. So it has to be pre-approved. And sometimes those get delayed. In fact, we just had a lady recently on an Advantage plan. Doctor says she needed a knee replacement. Advantage plan did not agree and would not approve it, so they wouldn't pay for it. So she's on her own with that knee replacement. Those kind of things are going to happen, but it'll never happen with the Supplemental Plan G. So that's a great thing that is not changing. There's still no pre-authorizations on supplemental plans. And then another nice feature about these is they're permanent. So when you get a supplemental plan, it truly is written for life. That insurance company can never cancel that policy once it's been issued unless you fail to pay the premium. You pay your premium, you'll have that thing for the rest of your life. You never have to worry about renewing it, requalifying for it. Doesn't matter how old you become, where you live, you can take them anywhere in the country. If you move, it's fine, take it with you. So you never have to worry about losing that policy. And it gives people really a peace of mind about their coverage. They never have to worry about that. Another nice feature is when you have a supplemental plan, you get to get a separate drug plan. With an Advantage plan, it's included, it's embedded. But with the supplemental plan, it's just added to it. So you have usually 15 to 25 plans to choose from. You're not stuck with the plan the insurance company makes you take, like an Advantage. You get to select your own a prescription drug plan. And so based upon the meds you take, based upon the pharmacy you want to go to, you can select a plan that's best for you instead of them forcing you to take a certain plan. All right. And then lastly, I do want to make it very clear, when can you buy these? Okay. What's the process of buying a supplemental plan? So here's what you got to realize. When someone first goes on Medicare, let's say someone goes on Medicare January 1, 2023. And they're going to enroll into Medicare, and they've got A and B dates of 2023. Here's what's going to happen. So this is someone that says, I want to start January 2023. This would be our B effective date. Now, we can actually apply for any supplemental plan 6 months prior to when we want that coverage to begin. A lot of people do that because then we can lock in the rates, all right? But what's real important to note is once this B date is started, now I have 6 months where I'm in this period of time where I can have any supplemental plan, any company, any letter that I choose that is in my state, in my area, with no underwriting required. And so I can apply for it 6 months in advance, no underwriting. But once this 6 months starts, in my example, this would be January, February, March, April, May, and June. So all the way 6 months before, all the way up to June of 2023, there would be no underwriting required. We call this our guaranteed issue period. Okay, in other words, the company has to write it. They cannot ask you any health questions, and they won't. They have to take all your pre-existing conditions. You're covered immediately. All right, no underwriting required. But once this 6 months window is over in most states, in order for you to switch supplemental plans, change companies, or change letters, now you got to go through underwriting. Now we have this process of asking you 25 or 30 health questions, check all your medications, get a statement from your doctor, and then after that 6 month window, those companies don't have to take you. So this makes this 6 month window prior to B date or 6 months after a very important period of time, especially for some of you who have some serious pre-existing health conditions or may be concerned about some of your health issues. They will issue that policy, but after that 6 months, they do not have to do so. Okay, now some of you are not going to start Medicare at 65. You may just start Medicare at 67. So let's say you turn 65 in January of 2023. But you're going to keep on working, and you're not going to start your B until, let's say, 2 years later. So you're going to have 1/1/2025, because this no underwriting period called guaranteed issue, this open enrollment period, is tied to the B date. That's when your 6 month window will start, and that's why we tell people if you're going to keep working, you don't have to do anything with Medicare as long as the group is 20 or more. If you do anything, take A only. Don't take B, because if you're going to stay on the group plan and now you have B, that 6 month window is going to quickly vanish. And now in order to get off that plan, you may have to go through underwriting. All right. So there's a proper time to buy these supplemental plans, and that would be 6 months before you go on Medicare or 6 months after that B date, because then we don't have any underwriting whatsoever. You can get anything that you want. All right. And so supplemental plans are a wonderful way to get coverage. There's some wonderful benefits to them as far as the way the insurance is going to work, but you have to decide whether you want to use a supplemental plan or an Advantage plan.